Good afternoon. My name is Braylon Reed, and today I'm going to be talking about why universal healthcare is so vital. In today's world, there are far too many people who live without proper medical services or healthcare because it is just too expensive. Everyone in the United States should be able to access quality healthcare in addition to resources. America is known as a global leader, yet other countries have established this method before us. In other countries around the world, universal healthcare has been put into place. What is universal healthcare exactly? Well, universal healthcare allows for more flexibility on pricing while also helping consumers receive what they need. I have a couple examples for you. For example, according to the Judy Center for American Progress Action, in 2009, nearly 47 million Americans were living without health care, and this number is shocking and yet scary. About 21 were uninsured and were below the age of 26. The Affordable Act insured the number of Americans. However, 27.4% were college students. Now, this is scary because myself, I play intramural sports, and if I was uninsured and I broke my arm, well, I would have to pay out of pocket, and being a college kid, college is already expensive as it is. Now I have to add on another $10,000 to get my arm put back in place. Another reason that this method, universal healthcare method, would be beneficial is because, it just makes healthcare cheaper. So universal, in essence, is just Medicaid for all. Medicaid is a national health insurance program to provide everyone in America with comprehensive universal health care coverage, free at the point of service, with no networks, no premiums, no deductibles, no co-pays, and no surprise bills. It would be a reliever for a lot of stress for American people. Universal health care, or Medicaid for all, would be beneficial to implement in our government. So, how do we intend to do this? Implementing universal health care in our society would have a positive effect on many Americans, but one of the most aspects that would change the price of Medicaid available for everyone as a citizen in the United States, portions of our taxes you're required to pay go towards the companies that develop these medications. However, Americans who are paying taxes aren't able to afford these medications. So it's one of those type of situations. So how would we implement this? Studies show that the cost should be between $25 trillion and $32 trillion over the next 10 years. Sanders has suggestions for funding it, including reducing $2 trillion of current government spending, along with raising taxes on income over $250,000, reaching the 52% marginal rate on income over $10 million. That sounds extensive, but we wouldn't reduce anyone's income if they made less than $250,000. However, you have the elitists who make $10 million, or you look at Jeff Bezos, who's worth $152 billion. He alone is 0.1% of what we need. With this plan in action, we can copy different countries' healthcare models. So we offer different plans. So our government, we have the single pay, which is what we're going to establish now. So the single pay consists of services are government-owned, service providers are government employees. Every citizen has the access to this care. By doing this, government health, they work to ensure doctors and hospitals provide quality care at a reasonable cost. They must collect and analyze data. They can show the use of purchasing power influence healthcare providers. The next plan is the social health insurance model. Included in this would be requiring everyone to buy insurance, usually through employers. The taxes go into the government-run health insurance that covers everyone, and private doctors and hospitals provide services. The government controls health insurance prices. It also has a lot of clout to control private provider cost. In fact, countries such as Germany have developed this system, in addition to France, Belgium, and the Netherlands, and Japan, Switzerland, and other companies. In 2008, Obamacare was making their way towards this. However, in the 2016 Trump election, he decided to repeal all these and put us back, and now we're in this state of iffiness. The final type of healthcare we could offer is a national healthcare. This healthcare model uses public insurance to pay for private practice. Every citizen pays into the national plan. Administrative costs are lower because there are insurance companies. The government has a lot of leverage to force medical costs down. Countries like Canada, Taiwan, and South Korea use this model. The U.S. Medicaid, Medicare, and TRICARE system would do this. An example of Medicare that is required for people of insulin is, an example of medication that is required for everyone is insulin. According to the ADA, or American Disease Association, the list price of insulin nearly tripled since 2002, and the average price of insulin has tripled 64% since January 14th, according to Rosenfield 2019. As a result, Americans affected by diabetes have to make an impossible decision. For example, I know someone who has diabetes, and as the price of insulin slowly starts to increase, it is becoming less affordable for her family. As a result, they have to make an impossible decision, avoiding purchasing their daughter's possible life or death medication, or missing out on other necessities such as food, electricity, and clothes on their back. Another example would be in 2002, my friend Danielle's mom was diagnosed with stage 4 colon cancer. In the 2 years to follow, her mom spent the majority of her time in and out of the hospital. This resulted in numerous surgeries and prescriptions, which left her family in a vast amount of debt. So if you slide down to slide 7, I have included a chart of the universal healthcare. So we discuss the plans they have under types. Their GDP, which is their gross domestic product, so it's the revenue of how much they made that year divided by the number of residents they have in their country. And then their per capita is how much each person makes. And then you have a very important part on the 4th column. So wait time 4 weeks. So I gave you the example of me breaking my arm earlier. So if we look, it took 22% people of their whole population waited 4 weeks or more. That is amazing, because you have people who are waiting 6 years to get a certain surgery. And then another thing we need to look at is their mortality rate, which is displayed in the 5th column. Patient wait times piggybacks off of column 4 and slide 7, And lastly, like we said, it just reduces administrative costs, which is more money in your pocket to help your family in times like this, such as COVID-19, when everyone's been put on furlough or getting laid off, and you're trying to make do with needs met. The bottom line, for universal health care to work, everyone, including healthy people, must pay premiums or additional taxes to pay for health care. This funds the security health blanket for all citizens. Ideally, with a healthcare system under government regulations, everyone will have access to quality healthcare treatments, such as a system would provide an affordable preventative care and implement strict control of pricing, quality of drugs, medical services. To conclude, U.S. healthcare is not exclusive as other developed countries. Instead, it has different models for targeted populations. Obamacare is closest to universal the United States has ever implemented, but it falls shortly to come. Thank you.